important, I would say, in preventing, not only preventing, but through COVID and post-COVID, hydration is the most important aspect. So it's not only water, according to me. You can drink water, but you can get fluid through different things like eating a fruit, trying to have soups in the day, take breaks where you take good amount of refreshments. And why do we need that? Because 75% of our body is water, and body needs water to function. Water carries nutrients, of course, to different parts of bodies, flushes the toxins out, and dehydration actually occurs in these kind of infections normally. So a lot of water is lost through infection, fever, sweat, side effects like nausea, vomiting, diarrhea. And then, if you have diabetes and other comorbidities, sugar levels are high, they can cause dehydration. So we do have to understand that dehydration needs to be taken care of. And I'll of course talk about more evidence that is published. But in terms of symptoms, we of course know that dry mouth, less sweat. We all these could be identified well, the color of the urine, but we don't need to go to that. We have to first make sure that we are drinking enough 2 to 2.5 liters of water every day. And while we are doing that, I will reiterate, and I'll first present some data which the American Society has for Parenteral and Enteral Nutrition, ASPEN, has said that nutrition and hydration are key weapons in the fight against COVID-19. So body fluid, fat and muscle losses impact your ability to fight the illnesses and the recovery. So what is very important is already said, and hydration and nutrition play an important role in your body's response to and recovery from the COVID-19 virus and are essential part of our medical treatment. Aspen suggests that drinking beverages which provides calories, essential electrolytes, and I want to repeat, essential electrolytes and minerals that your body needs, and consider using the oral nutrition supplements. So this is one area. Apart from food, we need to take supplements, and I'll go to what supplements could look like. But what we have seen, there's more data which says that COVID-19 severities and long COVID is actually associated with lower serum concentrations of sodium, potassium, and calcium. There was a recent BMG article which also spoke about doing a proper test of your electrolytes, and this is exactly what happens. And it should be recorded in the initial presentation of the infection itself to the later part. So understand that these disturbances can not only cause hypokalemia, but uh, it can slow down the process of removing the toxins which we understand in a normal language. So having said that, there is more reference again which talks about salt induced pathways which are important, which play an important role in T cell immunology. I'm not going to go over all these points with yeah, keeping in consideration the time that we have, but salt induced enhancement of leukocyte function are not confined to macrophages that belong to the innate immune system, but they operate in T cells, which form an essential part of the antigen specific adaptive immune system and whose function is known to be governed by various microenvironmental cues. For almost 2 decades, it has known that increasing NaCl conditions by approximately even 40 boosts the interleukin 2 expression and the T cell proliferation. So there are more benefits of the salt induced pathways, and we have to understand that it has a key role in immunology. So that's in a gist how electrolytes play an important role. So normally a lot has been spoken about in this. Everyone has spoken about having zinc, calcium, having vitamin C, taking copper, selenium, and so many water soluble vitamins. So but are we going to be able to essentially get that from these kind of foods when we are not well? I'm sure we are not going to be not going to have the taste. First of all, the taste is gone. So consuming these kind of foods may always not be possible. We have to still try to do it through fruits and vegetables and trying to eat balanced. But if we are not able to, this is highly recommended that we should actually supplement out here. Keep yourself hydrated, make sure that the electrolyte balance is there in your body. If you can have supplements which have all of that together, having vitamins, water soluble vitamins and minerals, along with antioxidants. So vitamin C we know is a natural antioxidant. There are quite a few herbals also which ashwagandha, amla. They've spoken. We have grapeseed extract. All of them, if we can, if we have a combination of that, and if we can replenish our body with all that continuously along, and not to forget the electrolytes, then we are going to be in a better situation because our cells are going to be hydrated. So at the cellular level, our body is going to be strong, and if that happens, then the virus or any other infection or any other disease can attack at several locations. We can have the free radicals attacking at any location, but your cells at that smaller level are strengthened. So understand, this is very important, and this is simple. This is something which nutrition can do, which our own body can do. So we have to keep that in mind. Then I want to address also the point of proteins, because everyone talks about proteins to be taken during, when you're, first thing is said the Indians don't eat enough protein. So we start there. From prevention to, any recoveries, we talk about protein. But do we, what's that is really important? You have to understand that protein break down into amino acids. So the amino acid profile of the proteins that you are actually giving to your patients, or the proteins that you're consuming, the amino acids are very very critical. And what they do? They of course help us build muscle, give us recovery. But main thing, they give us energy also. So they give us energy, muscle, and most critical, I would say, are the hormones, enzymes, and antibodies. These three things need the amino acids. So it is very critical to have proteins for these three main reasons as well. So not only to get energy, muscle back, but if we are able to manage the balance between hormones, enzymes, and if the antibodies are developed well, then the innate immunity can be kept under control, and the mess that we come across because of the overactive immunity can actually be taken under control. That is the reason why proteins can be preventive. Proteins can be uh, can help us through the infection and also post the infection. So that's how critical proteins are. And where should we eat the proteins from? They should normally be from all different sources. It should come from meat. Now most of our population is vegetarian, so if we are vegetarians, we must consume dairy. We should get the proteins from dairy. If you can eat an egg, great. If not, you can eat cottage cheese, which is paneer. You can also consume, if you want, tofu and nuts, and there are endless number of so many different types of pulses that our country has. And that's a gift. So the plant proteins are very very much available with us, so we should consume them in different forms. So a balance of all these proteins coming from different sources is a great idea. However, when we are going through severe infections again, there is an absolute need for medical nutrition therapy, and especially protein should be a part of it. But again, like I said, the protein should meet the requirement of crucial amino acids, and which are essential not only for energy but, like we said, antibodies. So building immunocompetence is actually something which is critical. And what are the different types of amino acids you normally focus on is, isoleucine, leucine, valine, of course, have to be there. But glutamine and arginine are again very, very important. There is a lot of data that is published now that it's seen to improve cellular immune function, fight infections, increase muscle and bone strength, enhance recovery from illness. It also, arginine is excellent. It improves circulation, and there is data that the hospital stay is reduced. So in COVID kind of conditions, is always better if our hospital stay gets reduced as well. So a lot I've already mentioned, but immune responses, including the proliferation and activation of the T lymphocytes to beta lymphocytes to natural killer cells, macrophages. In all these, amino acids are extremely important. So I did mention that arginine. So nitric oxide, which is produced by arginine, may actually help inhibit the SARS-CoV replication cycle. So there's data on that as well. So nitric oxide has also been reported having an important role in regulating airway function and in treating airway inflammation and lung diseases. So that's why I keep saying it's important to focus on these amino acids, which we are going to get from the proteins. So another, I would say, important learning that why we need to take proteins, what are the type of proteins, and why supplementation of proteins is critical, because we will not be able to get all these critical amino acids in the measures that we want. We can actually titrate our doses of proteins and help our patients recover. The most another important point which I always keep talking about, and I've spoken about this